Welcome back to Pain Diaries. I'm Dr. Suzanne Manzi, physician owner of Performance Pain and Sports Medicine here in Houston, Texas. I am so pleased to introduce my guest, mentor, and friend, Dr. Johnny Peet, who's located in the Woodlands, Texas.
Hello, welcome.
Hi, thank you so much for being here. I'm so excited you're able to join us. I know you're busy, and I want to take a deep dive into hormone replacement therapy with you since you're known as the expert. So, can you explain the role of hormones and the use of thyroid hormone and iodine in our health and how imbalances can really affect our overall well-being?
Yes, so first of all, let me address the expert comment. I'm always hesitant to be an expert at anything because it's hard to teach an expert much. So I like to learn something new every day. I'm sure I'll learn something new on this show. So never strive to be an expert. As experts learn anything new, right? Um, so thyroid and iodine is a topic of mine that I've spent years and years delving into because of my own history with thyroid cancer and having to replace my total body thyroid. There are some books and things that I recommend on iodine. There's a great book by Dr. David Brown's you can find on Amazon or anywhere else that is about iodine, and everyone should read it. It's a book everyone should read. The United States of America is an iodine deficient country, and that's why the government put iodine in table salt 100 years ago in the 1920s. Unfortunately, the government put iodine, something you really need, in something you shouldn't eat much of, which is table salt, unfortunately. So there is no way to reliably get iodine and as much as you need from table salt. Matter of fact, you shouldn't eat table salt. It's not actually healthy for you. It can cause high blood pressure and fluid retention, etc. So sea salt and those kind of things are much more safe and natural and healthy, and iodine should be taken separately. Um, if you look at the health of some of the other countries, such as Japan and the Pacific Islands, those individuals in their normal everyday diet get 10 to 15 milligrams of iodine. And it contributes to the overall health of those populations where they live 6 years longer than us. So iodine is absolutely required for thyroid hormone production. Thyroid hormone produced in a gland in your neck here essentially controls your metabolism. And your metabolism controls your whole body. So without iodine, you cannot make thyroid hormone. And without thyroid hormone, you can't have a good metabolism. So if you look in Japan, they have very healthy metabolism. They live longer than us. And it affects everything in the body because thyroid hormone affects almost every single tissue in the body. So you would think it'd be strange to talk about hormones on a pain show, but there couldn't be anything more important when you talk about pain than talking about hormones such as thyroid and estrogen because they control how we perceive pain and how our brain processes pain. So hormone deficiencies lead to higher pain perception and more chronic pain problems. So if you want your metabolism to be good, you'll supplement with iodine every day, and I recommend 10 to 15 milligrams, which is the average daily intake in the Pacific Islands and in Japan, etc., where they eat seaweed salads instead of Caesar salads, and wrap their sushi in seaweed, and they eat swordfish and things like that that are very high in iodine, things that we don't get here in the U.S. And we have a epidemic of poorly functioning thyroid in the United States of America. There's no question about it. When
Absolutely.
when people say they have a thyroid problem, I would say over half the time they're right. But unfortunately, traditional medicine doesn't treat that appropriately and doesn't actually have anything to offer those folks. So, um, thyroid is extremely important for every body function that we have, every body system. It's actually very important for pain and pain modulation and pain sensing. So, iodine is something everyone should take, man, woman, child, adult, or even infant. So, um, all beings need iodine.
Thank you so much for that. I know once I started myself on thyroid supplementation with the iodine supplement, it's really amazing, the energy levels too. And for my patients, since I am practicing pain management, incorporating these strategies into my practice have just made people's lives so much better. So you did talk about some estrogen as well with pain perception. And so let's bridge from the iodine and thyroid hormone itself to the female hormones as well as testosterone. Can you talk about the misconceptions and myths surrounding hormone therapy for women? And then also, can you talk to us about the safety and appropriate usage of hormone replacement in females as well as males?
Sure, and it's going to center around estradiol, 17-beta estradiol, the most important estrogen in men and women. Why does estrogen have a bad rap? Really and truly, it's media driven. It's not science driven. Hormones that are available from big pharma and approved by the FDA are synthetics. They are not the same hormone, most of them, that your body made, male or female. And the second thing is they're given orally. When you take an oral hormone prescription, those go into the portal circulation from your intestines and go straight to your liver. Your liver has to do the work of metabolizing these compounds. After the metabolization is complete, what is left over then goes out to your body and hits all of the hormone receptors. Well, when your liver has to work that hard to metabolize something, it actually changes other functions of the liver. One of those is in creation of clotting factors. So when you make more clotting factors, your blood tends to clot easier. That increases the risk for things like blood clots in your legs or lungs, or heart attack or stroke if those are clot related. So essentially, estradiol, which helps to prevent heart attack and stroke, when it's given in oral form, not only does it increase your risk of blood clots in the legs and lungs, it no longer protects from heart attack or stroke because of the oral form passing through the liver. So when you talk about risks of hormones, that's one we talk about. We talk about blood clots, heart attack or stroke if they're clot related. That is only because of the delivery system chosen. Now, when we choose a pill, we're choosing the easiest thing to make to deliver a drug to a person. It's the cheapest and the easiest, and that's why Big Pharma uses it the most. But if we avoid the liver, then those risks are completely eliminated. There is no increased risk for blood clots in your legs or lungs, and there is cardio protection from heart attack and stroke. That is if you use something that does not go through the liver. So those delivery systems include sublingual, transdermal in a cream, transdermal in a patch, or subcutaneous pellets. All of those delivery systems place the hormones directly into the bloodstream, bypassing the liver and not affecting your clotting factors in any significant way. There are no clinical studies that suggest that non-oral estradiol increases your risk of blood clots. And most all of the studies show that it lowers your risk of heart attack and stroke. So estrogen is good for you. It is a myth that it's not. What some drug companies make for you that they call estrogen is not good for you and not safe. I agree with that. When you use the right molecule and the right delivery system, it is safe. So a big myth about estrogen is that it's a female hormone. It's not a female. I run my men and my women at the same estradiol levels. And estradiol is protective against chronic disease such as Alzheimer's, colon cancer, type 2 diabetes, heart disease, osteoporosis and fractures. And it protects men and women the same. Now, how do men make estrogen? Well, they don't make estrogen directly. They make testosterone, and their body turns testosterone into estradiol, and it protects men just the same. Men need estradiol exactly like women need estradiol in actually similar doses. It's actually not a big difference in the doses, but all of the receptor sites in the male and female body are the same for estrogen. So it protects men from the same thing it protects women. And one of those areas is joints and pain. Muscles, tendons, and joints all have estrogen receptors. And a lot of my men that we treat with testosterone, once their testosterone levels start to go down again as their treatment is wearing off, their estrogen levels also go down with the testosterone. And what is one of the most common symptoms that they feel? It's joint pain. Their joint pains come back, and they know they're due for treatment. Um, and being a gynecologist, I've been dealing with menopause-related symptoms for 25 years in my office and with my patients. And most people don't realize this. Everyone considers hot flashes to be the most common symptom of menopause. It's actually not. The most common symptom of menopause is joint pains in women, and that's pervasive. In other words, the the hot flashes may go away after 6 months or a year or two, but joint pains don't. And estrogen deficiency causes joint pain, and there's no question about it. And replacing the estrogen helps you to fix those problems of the pain.
No, thank you so much for clarifying all that, because there's been so much controversy and myths around hormone replacement. And so we appreciate you demythifying the estrogen and the thyroid hormone. How about testosterone? Now, I know people think testosterone is a male hormone, but again,
Another
it's in the
myth,
female body
right?
too.
The myth. One more thing about estrogen that I do need to mention, because you had talked about myths and the risks and things. The other thing that everyone talks about with estrogen, right, is breast cancer. Everyone's concerned about breast cancer when you give estrogen. And what most people don't know is those problems started back in 2002 when the Women's Health Initiative placed on the cover of Time magazine an article that stated that hormones might be dangerous for you. In that study, the preliminary data after just a few years of treatment showed that estrogen, synthetic estrogen plus synthetic progestin orally might be increasing the risk of breast cancer. Now, estrogen was not increasing the risk of breast cancer in that study, but the study was halted early anyway, and this was placed on Time magazine, and everyone assumed that it was the estrogen. It was not. Now, another study came out just 3 years ago that looked at the same exact patients in the Women's Health Initiative, and they followed those patients for another 17 years, okay? Those women that were on Premarin, which is not a hormone I use because it's given orally and that's not safe, but on women that use Premarin, they were less likely to be diagnosed with breast cancer, and they were less likely to die of breast cancer. Now, I want you to think of that for a minute, because this is the same study that made everyone stop their hormones. Right now, to date, in all of science that surrounds publications for hormone therapy, there is only one medicine that has been proven in a prospective, randomized, placebo-controlled, long-term trial to decrease your chance of getting breast cancer or dying of breast cancer. And do you know what that medicine is, Dr. Manzi? It's estrogen.
Estrogen, of course.
It's estrogen. It's the only medicine that's been proven to keep you from getting breast cancer or dying from breast cancer.
Yep.
Now, why wasn't that study in 2020 on the cover of Time magazine? I don't know.
Because the media took it and ran, but then they never fixed it,
Yes,
unfortunately.
exactly. So testosterone, just like estrogen is not a female hormone, it's important to know that testosterone is not a male hormone.
Right.
Men will make more testosterone in their life than any other hormone. That's more than progesterone, more than estrogen. So of all the sex steroid hormones, they make more of that than anything else. The difficulty is it's in the first half of life.
Yeah.
And at that point, once women are in their 30s, their testosterone levels begin to decline to the point where they become symptomatic. And that is 10 to 15 years prior to menopause, where women lose their estrogen and progesterone. Now, what symptoms does that cause? Well, essentially, the symptoms of testosterone deficiency in women are identical to the symptoms of testosterone deficiency in men, because the receptors are in the same tissues. That's fatigue. It is mood problems, depression, irritability, anxiety. It is sexual dysfunction with pain with intercourse or decreased libido, poor sleep, loss of muscle tone. All of these things are testosterone deficiency symptoms. And unfortunately, what happens in our healthcare system is in their 30s, when these women are losing their testosterone, they go to their doctors and they get put on antidepressants, sleeping pills, medicines for ADD or focus. So what's happening is our system treats the symptoms of testosterone deficiency in women, but it
For
does
sure.
not treat the deficiency. And in other words, we're masking the symptoms and letting the disease continue. And once you get on all these prescription medications, when you really look around, you don't feel any better. There might be a few things that are better, but now you're dealing with a whole myriad of side effects. So if
Absolutely.
we would if we would focus on the hormone and the deficiency itself, whether it's thyroid, whether it's testosterone, and focus on those issues and lifestyle modifications like nutritional supplementation and diet and exercise, we sure could avoid a lot of prescription medicines in this country.
Absolutely. I mean, you make it sound so easy and so logical, which it actually is when you break it down. It's just dispelling the myths and educating people one at a time, which is, why I'm here with Pain Diaries, so we can talk about it on air and people can know that there's options for them and there's wellness ways of life to prevent complications in the future. So tell
The big
people how they can reach you. Since you are in the Woodlands, what's the best way to contact you if they're up there and they're looking for somebody to help them?
No, just calling the office or hitting the website. Either one is fine. 936-273-9053 or 936-273-1600 will get you there too. We treat hormone deficiencies in men and women, and in doing so, we treat pain. And that's how hormone deficiencies work. They affect every body system, and it's so important to take a holistic approach where we use bioidentical hormones that your body recognizes. The receptors fit the hormones exactly, and your enzymes that your body makes to metabolize your hormones fit perfectly. And the byproducts of those enzymes breaking down your hormones don't create anything that your body doesn't recognize. And so the side effects are minimal, the benefits are great. We don't. The big question is, do we get old and lose our hormones, or do we slowly lose our hormones and get old? And I think it's B. And so you can restore that
Right.
youthful vitality by restoring your hormone levels to where they were when they were in your 20s, when everything worked well. And there's not any medical risk of doing that. The medical risk is of not replacing your hormones like they should be replaced.
So true.
Because we like patients to feel good. We want everyone to feel good, and that's great. But actually, we're more concerned with what happens with their aging over the next 20 or 30 years. Are they going to develop chronic diseases? Are they going to be debilitated? What we want to do is we don't want to add 10 years of nursing home years. We want to add 10 or 20 years of pre-nursing home years with
Absolutely.
good vitality and active life. And that's what we try.
Thank you so much, Dr. Peet. We are so grateful you're here with us today and sharing your wealth of knowledge.
You're very welcome.
Thank you for your time. This is Pain Diaries. We'll be back after a commercial break.